What is high blood pressure, its symptoms, causes, diagnosis, and treatment? 1. Definition and overview. High blood pressure is a condition that occurs when the amount of blood pumped by the heart exceeds the capacity of the artery walls. High blood counts can cause complications depending on the relationship between blood volume and arterial capacity. The more blood flows and the narrower the walls of the arteries, the higher the blood pressure. 2. Based on the cause, there are two types of high blood pressure. A. Primary or underlying high blood pressure, which may develop for years without symptoms, and B. Secondary high blood pressure, which occurs as a result of another underlying condition. Although high blood pressure is more common in older people, it can affect anyone at any age, including children and adolescents. People with high blood pressure have a higher risk of more serious conditions, such as heart attack and stroke. 3. The cause of high blood pressure. There is no definite cause of primary or underlying hypertension. Blood pressure develops gradually over years and usually gets worse with age. Secondary hypertension is a disease that eventually leads to it. The following conditions are often associated with high blood pressure. A. Kidney problems. B. Adrenal tumor. C. Congenital vascular anomaly. D. Sleep apnea. Secondary hypertension can also be caused by the use of certain drugs and chemicals, such as A. Family planning pills. B. Fever medicine. C. Inhalation medications, decongestants. D. Pain. E. Alcohol. F. Cocaine. G. Amphetamine. 4. Main symptoms. In some cases of high blood pressure, there may be no symptoms despite high blood pressure readings. This can be dangerous because symptoms usually only appear when the condition is life-threatening. However, the symptoms usually associated with this condition are headache, dizziness, epistaxis, and balance problems. 5. Types of treatment available. Lifestyle changes are usually the most important thing recommended for people with high blood pressure. By reducing activities that increase the risk of high blood pressure, patients can maintain healthy blood pressure levels. Doctors recommend eating a healthy diet by reducing salt intake, exercising regularly, quitting smoking, and maintaining a healthy weight. People who are overweight can lose 2.5 kg, which can also reduce blood pressure significantly. Changes in diet are also usually prioritized to reduce sodium levels or salt intake. For patients over 51 years of age with high blood pressure, diabetes, or chronic kidney disease, the recommended sodium intake is 1,500 mg per day. Healthy patients without the disease can consume up to 2,300 mg of salt per day. Changes in lifestyle and diet must also be combined with the right blood pressure medication. Medications commonly prescribed for high blood pressure include thiazide diuretics. These drugs remove sodium and water from the kidneys to reduce blood volume. Beta blockers slow the heart rate and reduce the amount of blood pumped around the body. However, this drug must be combined with other drugs because these drugs do not work well by themselves. Angiotensin-converting enzyme (ACE) inhibitors, angiotensin II receptor blockers (ARBs), calcium channel blockers, renin inhibitor, alpha blocker. Alpha-beta blocker agents work in the center vasodilators. Aldosterone inhibitor. Blood pressure that remains high even after taking medication is called resistant hypertension. Doctors work with their patients to find the right combination of drugs and monitor treatment progress. It is also very important that people with high blood pressure take their medication exactly as their doctor tells them to. Taking the right dose at the right time is especially important when different medications are combined. Missing doses can negatively affect the condition and reduce treatment success. In hypertensive patients, it is important to carry out treatment with a specific goal. This goal, expressed as maintaining safe hypertension, depends on the health and age of the patient. The ideal blood pressure is 120 mm of mercury, but healthy adults over the age of 60 are advised to keep their blood pressure below 150/90 of a millimeter of mercury. On the other hand, Adults under 60 years of age should keep their blood pressure below 140/90ths of a millimeter of mercury. Finally, the goal of treatment should be below 140/90ths of a millimeter of mercury in hypertensive patients who also have other conditions such as chronic kidney disease, diabetes, or coronary artery disease. During treatment, continuous monitoring of blood pressure is very important for the patient's recovery and is very important to determine whether the prescribed medication is working or not. Therefore, it is very helpful if family members know how to check blood pressure so that it can be done at any time at the patient's home.
6. When to go to the doctor. Symptoms of high blood pressure usually do not appear until the condition has reached dangerous levels. Therefore, it is very important to check blood pressure regularly, especially if the patient has a history of hypertension or is currently undergoing treatment for chronic hypertension. Blood pressure measurements tend to be routine tests, so it is highly recommended that you visit your doctor regularly for a good checkup. It is also recommended to check blood pressure at least every 2 years from the age of 18, even if the patient has never had this disease before. Get well soon.